Welcome to Health and Safety Conversations. Here's your host, Tom Bourne.
Hi, and welcome to Health and Safety Conversations. I'm your host, Tom Bourne, and with me today is Seb Bulan-Worth. I've known Seb for a number of years. Seb, can you start off by telling the listeners a little bit about yourself, your journey in safety, and what you're currently up to?
Thank you, Tom, for having me in this show. For starters, we've worked long years with the National Safety Council together, training across the board in Queensland organisations for health and safety together. Right. But prior to that, I was working as a health and safety officer for a big non-profit organisation in Sydney, where I was basically responsible from 3 different factories where we did packaging, we did sewing, we did pharmaceutical packaging as well. So different industries in the factories. I worked in the factories as well. Prior to that, I basically worked as a training and development officer. So that's how I basically had started my career.
Excellent. And what are you up to these days?
These days, oh my goodness, it's a big journey. But so last 3 years since we both left the same organisation, I started to train businesses across Australia for mental health first aid training. But at the same time, I started to train organisations for calm suicide prevention training. Okay. Because I basically recognize that there is a space in there that within the organizations, we can actually improve the psychological health. And we're far more losing too many people for mental health problems. So basically, I ordered as myself a mission and started to train businesses across the board.
Excellent. Oh, suicide prevention. That's a big one, Seb. Can you tell me any more about it, how you actually go about teaching people, I don't know, to pick up the signs and symptoms so that, I don't know, we don't lose as many people to suicide?
Absolutely. Now, one of the main things that we need to remember is with suicide, if you look at the worldwide statistics, every 40 seconds, one person dies by suicide across the board around the world. Every 40 seconds.
That's huge.
It's huge. Like we can just do a demonstration like how I counted to 4, one person actually died by suicide. In terms of, if you look at it to Australia, if you want to know the statistics, within the 2021, we lost around 3,144 people for suicide. In the previous years, it was more male dominant, the suicide, but now with the new statistics, the suicide rates for females has started to increase as well. And suicide became the 15th leading cause of death in Australia. And literally 9 people dies by suicide every day in Australia.
Yeah. It's such a waste and it's such a tragedy. And I'm guessing it's not just a tragedy for the people who see no way out and leave us, but it's for the families and friends who have to pick up the pieces afterwards that it's also particularly hard.
Absolutely. So suicide just doesn't impact the person. It impacts their family, their friends and family friends. Their workplaces actually get impacted as well. So, and it is very emotional for everyone. Somewhere I read what it said is, as one of my idols, Michael Hempstead, said, when aviation industry, look at this, aviation industry had the plane crashes happening in 2015, they basically look at it across the world and said, why does in aviation industries, these planes are crashing and we're losing hundreds of people for it? So what they've done is they put a team together across the world, from engineers to the pilots to the designers to the governments, and put a team together and systematically work towards to preventing airplane crashes and losing lives for it. So Michael Hempstead, in one of his books, he basically literally said, suicide is a systematic issue as well, and we need to look at it as a systematic issue. In the past, we didn't say it's the pilot's problem and let it go. It is actually everyone's problem, and suicide is everyone's problem, and we need to deal with it as a society rather than individual people. Does that make sense?
Yeah, it certainly does. So suicide prevention training, I've got to ask you, who are your clients? Are they mainly corporate clients, or are they small businesses, or are they individuals?
I work with the health and safety space, and that's my niche market. So I literally work with the organizations, and it doesn't matter which sector as well, because when you look at the 9 people died by suicide, this come up from any spectrum of community. And when you look at the population, how many people works in Australia, then it can make sense as well. So I work with the trainers, to work with the mining sites, to airports as well. Like I just trained Townsville Airport for mental health first aid yesterday, just came back home. So my clients are anywhere, across the board in any sector in Australia.
Excellent. All right, moving on to mental health first aid. Look, it's something I've always believed is of value, but I've never got around to doing it. Can you tell the listeners what it's all about?
Absolutely. So mental health first aid is like the physical first aid. So with physical first aid, if we have an injury, we actually give them initial support and provide them help at that moment. And from that, basically, we ongoingly checking in with the person as how they are and how's their injuries. If somebody had a heart attack, we basically follow our doctor's ABCD and apply that physical first aid based on the guidelines, call an ambulance, and an ambulance comes in, and our professional, basically our support actually finishes. So mental health first aid it's like the physical first aid, initial support provided to a person. The person might be experiencing a mental health problem, or their existing mental health problem might be worsening for them, or they might be in a crisis situation. So what we do is we give them that support till that crisis situation is resolved, or the person actually receives professional help. So we basically stay with them. What we don't do in mental health first aid is fix issues, because it's a typical human behavior. We want to fix things. Someone comes to you and says, I'm separated from my wife. The first fixing thing is, don't worry, there's plenty of fish out there. You see, we try to go in that to fix that issue. It's a human behavior. But with the mental health first aid, we don't fix things. We are just a helping hand to give them a support so that they can actually get the help that they need from the professionals.
Yeah. The first time I kind of heard about mental health first aid, I think it was around about 2015, 2016. Has it been around for a while, or is it still fairly new?
No, it's been a while. So it's basically Mental Health First Aid Australia started the program around 2000s. So they looked at it, Anthony Jorm and Bethany Kitchener looked at it as, why we have physical first aid, but why we don't have mental health first aid. So based on that, the program actually started with a massive amount of research, not just looking at the theories of other people, what the professional says, but actually they went to the consumers. So what that means is people who are experiencing mental health problems, carers, support groups, mental health nurses, counsellors, and ask them if someone is experiencing a mental health problem, how they would like to be supported. If you're experiencing, how you would like to be supported, and they actually developed this program.
Excellent. All right. I was thinking. Work Health and Safety Act last yearish became updated. The Model Health and Safety Act became updated with more emphasis on psychosocial protections in the workplace. For employers, would having mental health first aiders employed in their organisation help them meet the demands of providing a safer, mentally healthy workplace for their workers?
Okay, so the legislation, in Queensland, for example, the legislation just basically updated with it last 2 weeks ago, literally, in terms of psychological health.
Yep.
Now, when you look at the legislation, it just says the workplaces are required to manage the risk. So, and they need to eliminate the risk. If they can't eliminate it, they need to reduce the risk of harm. That psychological health covers the workplace sexual harassment, the bullying and harassment.
True.
Fatigue goes in there, and mental health basically comes in there as well. Now, when you look at it, when you look at the hierarchy of controls, first aiders is a control. Training people to recognize the signs of mental health and then mental health problems or people who are struggling, and giving them a supporting hand and then encouraging them to get help is a control. In terms of legislation, it doesn't say that you need to have mental health first aiders.
Could it be argued that by providing staff with that training would actually help prove that they are providing that mentally healthy and safe workplace?
Absolutely, Tom. Very interesting part for it as well. A lot of people don't know how to start a conversation with someone.
True.
I was training somewhere, and I was doing a fatigue management training a couple of years ago in a mining site. And they had a major incident happen on site. So the site was locked down for 3 days. So the investigation was, the outcome was, the person who came to work that day was fatigued. But why they were fatigued was not just because overworked or not sleep well, it's because they were having their own struggles with the mental health. And the supervisor on the shift didn't recognize that. So he didn't, even if you recognize it, he didn't actually know how to start that conversation.
Yeah. All right. I think you've got your work cut out for you in the FIFO industry between suicide prevention and mental health strategies, I can tell you now. All right. Mental health and psychosocial health. It's become, in the last probably 2 years, the buzz phrases in health and safety. We've gone away from thinking about the dramatic physical injuries, like people losing an arm and a leg, or being flattened as a mining truck runs over it. And we're starting to actually see mental health as being equally as important, which is reflected with the legislation.
Yeah.
The figures around Australians suffering mental health episodes or crises, or whatever you want to call it, have they been stable for a while, or has there been a significant increase in the last few years?
Okay, mental health was always there, Tom. If you go back to history, World War I, World War II, Korean War, Vietnam War, mental health was always there. It's just something I think we grow up with the older generations. We grow up as you never talk about your mental health problems with anyone. It is a sign of a weakness. So that's why we actually never talked about it, right? But it was always there. So if you look at the statistics in the Australian community, in 2007, Australian government basically conducted a national survey, and they basically went into the people and asked them, are you experiencing a mental health problem? Do you receive help? What type of mental health problems you're experiencing? So they asked this question. So out of that survey in 2007, what they said it is 1 in 5 Australians experiencing a mental health problem, aged between 16 and 85 in any 1 year. And 1 in 4 is experiencing multiple mental health problems, right?
Yeah.
The thing is, after 2007, there hasn't been any survey conducted. So they scheduled one, budget cuts, they scheduled another one, budget cuts, but then the last one was to schedule for the COVID time. So we actually don't have new data that can tell us 1 in 5 or 1 in 3 or 1 in 2. We don't know. But based on that statistics, we can actually say that is 1 in 2 person who is experiencing a mental health problem, they're not seeking professional help.
Yeah, true. Do you find this is something I've thought, but I don't have enough knowledge to make a real judgment call, which is why I'm asking you. Do you find that it might be more men who are reluctant to come forth and admit they're struggling than perhaps females?
Probably both side of the aisles as well, but then it becomes generational thing as well. So, you know, older generation raised with their generation that's saying it's a sign of weakness, they actually don't express.
Yeah, that's my generation, Seb. Thanks.
My generation too.
But I know what you mean. You never. It's like a dog or a lizard that you never expose your soft underbelly because you know that someone's going to have a crack. That's the thoughts that we've been raised with. Yeah. All right. Previously, at another place where I worked, not so long ago, I was trained as this support officer, and it used to be called a grievance officer. We get basically given some minor training. Is that fundamentally the same as a trained mental health first aider?
We with the mental health first aiders, we're not counsellors. And we're not professionals who can actually give that support to people as a counselling and advice wise. So think about it this way. If you go to physical first aid training, did I teach you how to do open heart surgery?
No.
And do you become a heart surgeon? No, absolutely no. Thank God.
Yeah.
So mental health first aid is exactly the same. So people who finishes the course, they don't become a psychologist or a counselor. They just become someone who can listen to a person who is going through major struggles within their life.
Yeah. All right. If I wanted to enroll in mental health first aid training, how long does it take to complete?
Okay, so mental health first aid training is a 2 days training. It's a face-to-face training, but we do have online blended trainings as well. But, you know, I always recommend organizations to do it as a 2 days training, even though time is limited, because within 2 days, you actually can do the activities in the classroom, can ask more questions to the trainer as well. So it's a 2 days. Well, what we do it's a 6 hours training and comes around 1 hour plus break hours. I'm a very strict trainer, so I finish my trainings around 7.5 hours a day.
That's all right. That's all right. I remember you as a trainer. Dear. All right. On to something a bit more serious.
Okay.
We know the Act has been amended and greater emphasis on psychosocial hazards. We know the regulations, Section 42 of the WHS regulations requires businesses to have things like first aid kits on site, or at least access to facilities for the provision of first aid. It also tells you the numbers and the equations and the quotas of how many first aiders per how many staff, and more if you're in a high risk workplace. If we are considering psychosocial hazards and mentally healthy workplaces, should that be amended to also have ratios of staff who have been trained with mental health first aid?
It will be a great thing, isn't it? So it will be very similar with the physical first aid, but we need to sell that to the businesses, I suppose, and the government to make amendments on the legislation. Unfortunately, it will be great to have it, but they don't. But if you have more mental health first aiders in the workplace, you're actually benefiting it more. So let me give you some statistics. What am I talking about? In Australian businesses, it costs about $11 billion. Psychological health, mental illnesses at work cost $11 billion a year. And it basically includes the sick leaves. It includes compensation claims. It includes people not coming back to work for a long times as well, because it can take up to 6 months to bring back someone with a psychosocial hazard to bring back to work as well. And then it also includes the productivity, because it impacts the productivity of the workers. If the productivity impacted, your relationship with the people that you work with is impacted, but the customer relations gets impacted as well. So then that means the bottom line, your product is impacted as a business.
Mm. Yeah, I can see all that. I also know that according to Safe Work Australia statistics, that someone going off on a psychological injury costs businesses more than a physical injury on average, and they're also off work for longer than if you sustain a physical injury. So there's lots of good reasons why anything that can help manage and control those risks in the workplace is done. Okay, Seb, you're based in the Brisbane area. I still think you are based in Brisbane still?
I am still in Brisbane.
Excellent. All right. If my business is not in Brisbane, can you still help me or not?
Absolutely. I travel across the board everywhere. I was actually in Perth a couple of weeks ago, training one major construction company in there in Perth. So I actually go everywhere, anywhere in Australia.
All right. And the magic thing is, if someone wants to contact you and organise some training, how would they go about doing that?
They can come to my website and have a look at it. So it's WHSN Training Compliance, basically .com.au, or they can just go to Google, type my name in there, just Sebnem Bulan-Worth, and my business straight away comes back there as well. Or they can just send me an email, or they can call me. So my number is, if anybody is interested, 0754 992 406, so people can actually call me. Once they call me, basically I prepare a proposal for them as to how much it's going to cost, information with what I'm going to deliver, how I'm going to deliver, and come to an agreement. And from there, we basically travel. Excellent.
All right, Seb. Well, that's been a great discussion. We might leave it there. It's been absolute pleasure, as always, speaking to you, and it's been great to have you on the pod. Thanks for your time, and I look forward to speaking to you again soon.
Excellent. Thank you, Tom. Thank you for having me in your show. Thank you.
No worries.
Thanks for listening to Health and Safety Conversations with Tom Bourne. Until next time, stay safe and enjoy the rest of your week.